Hi folks, this is chapter 19 for organizational, interpersonal, and group communication. My hope is that the communication topics that I'm going to cover in this chapter are going to be familiar to you. Ideally, you would have heard them in your foundations course and maybe cross over into your mental health course. So some of these slides, my hope look a little bit familiar. Okay, so we know that communication is the exchange of thoughts and messages or information that is done by speech, signals, writing, or behavior. What's important for you to know is that communication begins at the moment two or more people become aware of each other's presence. Sometimes that's by a glance, passing by them, physical presence, or words. You cannot always control the actual reception or perception of the person who is receiving or delivering the information. In all communication, there has to be at least one sender, one receiver, and one message. There's always a mode or a medium through which the message is sent, and that can be either verbal, written, or nonverbal. We know that more than 80% of communication occurs in the nonverbal mode. One of the core management activities that cuts across all phases of the management process is centering on communication, whether it's between the nurse and the patient, the nurse and the nurse, or the nurse and physician relationship, or, for that matter, anybody on the team. It sits at the heart of what we do in our profession. When you look at this slide that has the picture of the sender, message, and receiver, what I want you to remember is that what's really important is the mode, and the mode is going to be right around here. So how we communicate that message, the mode in which we use, matters. And we're always looking for congruence between what is verbally stated and what the nonverbal cues are. So I want you to be mindful of the mode in which communication occurs. This is the summary of the communication process. We have external climate as well as internal climates. The internal climates tend to be the ones that are less predictable and more influential of the outcome of a communication interaction. Our internal climate really shades how we perceive information that is being shared with us either verbally or non-verbally. So that goes back to the mode in which we share information. If it's in writing and it's very black and white, we're less likely to use our internal climate than we are if things are done verbally or non-verbally. Non-verbal cues are probably the most vulnerable to our internal climate, where we start really using our values, our feelings, or our own temperament, or the stress that we're experiencing to perceive what's being said when it's not being clearly stated. Manager communication really is a priority skill for a leader and manager to master. It's important that effective leaders are congruent in their verbal and nonverbal communication. We just spoke on the last slide about the importance of our nonverbal matching our verbal communication. When they don't match, it violates our trust or comfort with the person that we're engaging with. So congruence is important. Leaders also need to be sensitive to verbal and nonverbal messages, and they need to be mindful of how they're being perceived by the person they're communicating with. Again, I want to remind you that when there is incongruence, people tend to fall back on the message that's being sent through nonverbal communication. So if the person is saying something that by word choice is agreeable and affable and appears to be non-confrontational, but their body language is hostile or indifferent, or there's eye rolling, or the arms are crossed, or there's a tone, people are going to look at the nonverbal behavior before they pay attention to the verbal behavior. So when there's congruence, people by default almost always look and trust the nonverbal cues. So that's the reason that managers need to be very consistent in their messaging when they're dealing with their team. These are the channels of communication. I want you to be aware of the difference between downward channels and upward channels. We want to look at, think about downward channels tending to be more of a autocratic type of leadership style, a bureaucratic leadership environment, whereas upward communication tends to have more of a participative type of feel, more of a transformational type of leadership environment. So I want you to be able to look at these and be able to discern the difference between the two of them. Variables affecting organizational communication. When we think about this as how well we can communicate throughout our organization, when we look down at how we communicate, the difference in gender or power or status significantly affect the type and quality of organization and unit level communication. The more the number of people involved in filtering the communication, the greater the chance of distortion. So think about organizational communication through a hospital. If we have to share information from one department to another department to another department, and then it needs to filter down through the department to all of its employees, we have to be very careful in our messaging and how we choose to share that information so that the messaging doesn't get distorted. Very often that's the reason that we default to written communication. It's less likely to be altered by those internal climate cues that can make us reframe things or reword things to reflect our own thoughts or feelings about something. You think about the childhood game of telephone. I realize that you guys are probably way too young to remember playing telephone with two tin cans and a string tied between them. But that was, that you could talk with one another and the message be garbled and unclear. The telephone game maybe you played was sitting in a class of seats in a row and one person whispering a message to the next person and then them passing that message from a whisper from ear to ear to ear until all 30 or so students in the class heard the message. And you'd have the person at the end of the game say, well, this is what finally got to me. And it was nothing even remotely what the original message was. That's the same thing when we look at organizational communication. So we need to be very careful in how we control those variables. When we think about communication strategy, it's important that we understand the structure of the organization. We have to be mindful that communication is not one way, that we have to keep communication clear, concise, and simple. Again, if you're going to be sending a written communication, those messages need to be very clear, very short, not pages and pages of narrative. If you're going to give a verbal message, it needs to be scripted and very crisp. And then when we look at the use of multiple communication methods. So when we're trying to deal with layers and layers of bureaucratic design or organizational barriers, when we use multiple communication methods, we're more likely to impact all layers of an organization. So we may use social media, we may use an email system, we may use text alerts. All of those are designed to come at the same information just from different methods. And we want to avoid not overwhelming people with unnecessary information. We want to be professional in our communication, but we don't want to put in lots of information and distractors that are not necessary. So again, that goes back to being clear and concise. The important key for this slide is to remember that although information and communication are different, they are interdependent. So I'm going to communicate information and I'm going to share those the information through communication. Our slide tells us that information is a formal, impersonal, and unaffected by emotion. So an example of information is there has been a policy change that is going to affect how you insert a nasogastric tube. And communication is how that information is being communicated. It involves the perception and feeling. It does not depend on information and may represent shared experiences. So if I'm going to share the information of a policy change, I'm going to use communication to do that. So the mode of communication I use needs to be properly fitted for the information I'm sharing. So in a policy change, I'd likely put that in a written format versus sending it to you by text message or informally telling you at the nursing station. It's important for us to understand that information sharing has to be done consistently and clearly, and that we have a responsibility from a leadership standpoint to make sure that information is shared in a venue and in a method that is meaningful for the person that's hearing the information, as well as an appropriate mode of using that, of communicating that information. Channels of communication, I think these are pretty straightforward. Upward, of course, is going up your chain of command. Downward would be going from leadership down. Horizontal would be peer-to-peer. Diagonal would be across disciplines, so nursing would be speaking to respiratory therapy. The grapevine communication is an interesting concept. I think we've talked about this in another course. The grapevine communication flows quickly and haphazardly among people in all hierarchy levels and usually involves 3 or 4 people at the same time. Senders have little accountability for the message, and often the message becomes distorted because of how quickly things move, the communication is shared. This is the one channel that can really break a leader. Consider grapevine communication as an unofficial backdoor channel of communication, and it is perceived to be highly reliable, although it is highly unreliable. When there is grapevine communication that is going through an organization, it needs to be dealt with quickly, and it needs to be dealt with in person. This goes back to dealing with things in an authentic way. When an example of this would be that there's rumors that there's going to be a merger, and there's murmurings that everyone's going to have to reapply for their position, or they may not be employed. A good leader is going to go into their team and they're going to say, my understanding is that this rumor is occurring. I want to give you the correct information about what's actually happening, and then we're going to talk about next steps. And that's done in person in a formal way, and to start with the largest group of people possible in an appropriate venue, like a staff meeting that would be called. Communication modes, written, verbal, nonverbal, we've talked about these. I want to encourage you to think about written communication as something that should be avoided when emotions are involved. And I want to put text messaging in written communication. We know that it is very easy to misconstrue something when there's a lot of emotion involved. So think about an email that gets sent that has a directive tone to it or a stern tone to it. People can respond in a very negative way. So if you have information that is emotionally stressful or distressing, it is important to use good verbal communication techniques to go and speak with the person directly affected by something that could be emotionally charged. You do not want to have an email exchange that goes back and forth when there's a conflict that's emotionally charged. You want to deal with that in person. Now, that does require you to deal with it in a professional, non-confrontational manner and use verbal and nonverbal communication that's congruent, so that you're not sending mixed messages to the other person, so that you're not making them more anxious and more nervous. The idea would be to be professional in your verbal communication and professional in your nonverbal communication, so that you can congruently communicate a message that could be emotionally stressful for someone. Nonverbal communication, I think these are all pretty straightforward. SBAR, I don't feel like I need to talk that one to death for you. This is something that you guys have lots of exposure to. Your article this week is Cornell et al., and they look at your authors this week look at interdisciplinary rounding and the use of the SBAR tool. What they found was that if they used the SBAR tool in interdisciplinary rounding, that there was increased rounding efficiency and there was increased HCAP scores. HCAP scores are the metric that we use for patient satisfaction. So when they used a standardized tool like SBAR, when they did intraprofessional rounding, and that's bedside rounding with all the professional groups together, that they found that they were more efficient because they were talking the same language and using the same tools to communicate. And they found that the patient's perception, which is what HCAP measures, was showed an improvement in the patient satisfaction. The authors found that the key to success for the use of SPAR with IDR rounding was that the technology and training had to be effective for everyone. Everyone needed the same training, and they needed the same level of training. Again, that goes back to being consistent in how they were using a tool to communicate information at the bedside. So that's a pretty quick read. So make sure you take a look at that article. Listening, this goes back to remembering that a person spends 70% of his or her time listening, but only a third of the messages are retained. And this third is if you're using good skills. So it's important to not just while someone's talking, for you to be thinking about your response, because that isn't a good listening skill. Good listening skills are as important as verbal skills for a manager, but that means active listening and actually paying attention to what's being shared with you. This mnemonic is something that your book came up with, and I'm not a big fan of it. I'd like to just take the grr away and just have you remember that good listening, when you are communicating with someone, that you're going to have a greeting, which is your first G, that reflects a positive tone in a positive environment. A respectful listening is listening without interrupting, pausing when needed. Reviewing is recapping what you think was said to ensure accuracy. And that looks like, so I hear you saying this, and repeat back what you feel like was said. Recommend or request more information. What that means is that in the process of communicating with someone, if there's something that you don't understand or need clarity about, for you to be able to say to the person, tell me more about this, or could you give me more information about this part of what you were saying? Reward is basically thanking the speaker for a positive dialogue. And what that would look like would, let's say an employee came to you to express a concern and asked for you to address it. A reward would be for you to say to that employee, I'm grateful that you took the time to come speak to me and that you trust me to handle your concern in a way that meets your needs. I don't know why they couldn't have come up with another word for reward, but that was what the authors decided to use. I want you to get the general gist of what good listening looks like, and to understand that when we set a positive tone and when we listen without interrupting, when we recap what the person is saying to us, we ask for more information when things aren't clear, and we reflect an appreciative tone when someone trust the relationship enough to bring a concern to you, that really does tell the person, I'm really listening to you. And that's pretty important from a leadership standpoint, that we do spend a lot of time communicating, but we need to spend more time in the listening component of our communication. When we think of proxemics, what I want you to be thinking about is the general gist of this is the zone of psychological comfort that acts as a buffer from unwanted touching or acts. Proxemics varies depending on who you're speaking with. If you're speaking with your child, proxemics is going to be very close. If you're speaking with someone that's a stranger to you, that you don't know, proxemics is going to be different. The goal of a leader is to determine an appropriate level of physical distance and space between the leader and the employee that facilitates communication. If you need to have a conversation with someone that needs to be about a corrective action or a behavior they need to address, that's going to probably something that you're going to give a little bit more physical space to, because you're going to have to be very direct with them, and being too close may make them more uncomfortable. If you're dealing with an employee who's just found out news that they're upset about, let's say that they got a phone call from home that said someone's sick, you may want to be in a closer level of physical contact that would reflect someone that's being supportive or nurturing. So, again, be thinking, if I'm from a leadership standpoint, if I'm too far away, if there's too much distance, I'll be perceived as aloof and unfriendly. If I'm too close, if I'm in people's personal space, that would make people uncomfortable and may feel violated or distrusting. So you want to find the right mix with the right person. Assertive type styles of communication. I love these bold women. When we think about assertive, passive aggressive, and passive aggressive, our goal is to always to land in the appropriate type of communication that's appropriate for the situation. We think about Cruella de Vil. That clearly reflects someone who's super aggressive. She was collecting puppies for nefarious gain. We think about Alice in Wonderland. She was very passive and very, oh my, what will I do? Not taking a whole lot of initiative or responsibility for the circumstances she was in. When we think about Pocahontas, you think about an assertive, brave woman who's standing up for the right things and taking a step forward and being bold and being brave, but not doing it in a threatening manner. Passive aggressive people, I think we can all think of someone who's passive aggressive. I would say that passive aggressive is the style of communication that is never going to be appropriate. I would say aggressive communication is the next least favorite type of communication. I can't think of a professional environment where being aggressive would be appropriate. There are times that you need to be passive, and there are times that you need to be assertive. Being passive may be in a situation where you're not in a position of power and things are being communicated to you that you're going to need to simply accept. So you are going to need to be able to kind of take a step back, give yourself some time for reflection, give yourself time to think through things, and then later deal with something assertively. And assertively tends to be... I'm sorry, as you can tell, Gracie and Madeline are playing behind me. And I'm pretty sure that was Madeline that just got bitten. Okay, so when we think about misconceptions and myths about assertiveness, all behavior is either assertive or passive. And that's not true. To get what you want, all you have to do is be assertive. Also not true. Being assertive will increase the odds of getting what you want and increase your self-esteem. And to be assertive is to be aggressive. That's not true. Assertiveness is unfeminine. Also not true. And assertive communication is rude or insensitive, and it doesn't have to be. I want you to be thinking about assertiveness as a way to communicate that allows the person to express themselves directly, honestly, and in appropriate ways that don't infringe upon other people's rights. That's not aggressive, it's not passive, it's being able to communicate effectively. When you think about dealing with aggressive communication, it's important for you to reflect on what's being communicated, repeat an assertive message, point out implicit assumptions, and restate the message using an assertive language, and then to question what's being asked. Think about dealing with aggressive communication with someone coming into your office and demanding that you change their schedule because they don't want to work every weekend. You're going to use the skill of reflecting and be able to say to them, I hear you saying that you're unhappy with your schedule. If they continue to be verbally loud and aggressive, then you're going to repeat an assertive message. And what that says is, I can hear your concerns and I'm happy to talk with you, but it's not okay for you to come into my office and yell at me. Point out when the nurse leader looks at pointing out implicit assumptions, what this is referencing is the need for the leader to make clear that they have heard the person who is being aggressive, that they've clearly heard the message. If the message was that they were upset about their schedule and want help fixing it, then again, that goes back to stating, it is my understanding that you would like help fixing your schedule. Restating the message using an assertive language. This goes back to rephrasing their question of saying, okay, so what you're telling me is that you are scheduled to work weekends and you feel like that's not fair because your other colleagues aren't working the same number of weekends. The other step in this in dealing with aggressive communication is questioning things that are unclear. And this especially goes to nonverbals. If the person comes in and says, I just have a question, about my schedule, but their tone and their demeanor, they are red in the face, their fists are clenched. It's clear that they're very angry, but they're trying to act as if though there's not a problem. It's appropriate for you to be able to say, you appear to be angry. Let's talk about this and see if we can work through this. Or ask them, you appear very tense. Are you upset about your schedule? Give them the opportunity to address an emotion or a feeling behind their nonverbal behavior, especially if they're threatening and it's beginning to escalate. Clarify that you do feel threatened or that you sense a threat. It's important for you to be able to state that and address it from a leadership standpoint. These are virtual communication modes. One thing I want to remind you about all of these is that HIPAA is protected, and that as we get more and more fluid with using social media, especially in the healthcare setting, we have to be very mindful that when we are taking pictures or we're tweeting or we're posting things, that we are respectful of patients' privacy, that we do not post pictures from a clinical environment for any reason, that if we do take pictures in the work environment, that they are not related to patient care at all and do not contain any patient information. It wasn't too long ago I had a group of students take a picture that had them all together as their last day of clinical, and when they snapped the picture, they were standing in front of the patient assignment board. So the patient assignment had room numbers and last names. While nothing was intended, there was no intent to violate HIPAA. It's actually a HIPAA violation, and when this was posted on social media, it needed to be addressed. So be mindful of those things. Always be aware of your surroundings. The internet is highly valuable. It really does open doors, and it is super important that we have the internet and we have media resources to help support evidence-based practice. So while there are positive components to our virtual communication, we also have to be very mindful, and typically what we need to be mindful of is violations of HIPAA. These are the stages of the group process, and I do want you to be aware of these. NCLEX likes to ask questions on these as well, so it's important that you are familiar with them. The first phase is the forming phase, and that's when the group gets to meet each other and gets to know each other. The storming phase is the step when the group establishes their identity. This is the push and pull of figuring out who's going to do what and start dealing with some of the logistics. Norming is the establishing rules and the designing of the work. This is when the goals are set, and that would include short-term and long-term goals in the norming phase. Performing is when the work is actually being done. It's when everybody's getting together, staying on task, and working through issues. There's a fifth phase that's occasionally thrown in there, and that's the termination phase. Leaders use this phase to guide members to summarize, express feelings about the group process, and then maybe celebrate successes that have occurred. I do want you to be aware of each of the steps, the forming, storming, norming, and performing, and also kind of hang out there and remember that termination gets thrown in there. When we think about guidelines for groups, we need to remember that adding new members to an established group can disrupt the productivity and the group development. So once you've formed a group, it's important to be congruent and stick with just the people that are in the group. Group members perform certain important tasks that facilitate work, and everyone will have a role in the group. Group members also perform roles that assist with group building activities, and some group members will perform roles to meet their individual needs. Basically, what that's saying is sometimes people are performing in a way that's meaningful to support a group, and sometimes people are working in ways that are meaningful for their own success, and those can be disruptive. This is the group rules for productive meetings, and you can read through that. That's pretty straightforward. Group building and maintenance roles, these should look familiar for mental health. There's not anything overly interesting here. What's important to take is that these group building roles are positive roles and used to facilitate group practices. Individual roles within a group, these tend to be the people that are in a group and are disruptive. So when we think about group building, those are productive roles. Individual roles within a group are disruptive. So I want you to be familiar about the difference between group building and individual roles. and be able to look at the difference between the two. And a last note about confidentiality and HIPAA. It is so important that we remember that in all communication, whether it's verbal or written or text or Twitter or social media, or whatever we're doing in communication, that we are always protecting the confidentiality of our patients and their families. Be very mindful of how we communicate information and make sure that we're doing everything we can to protect them. I want you to make sure that you've read the article that goes with this week's content. Seek clarification if you have any questions. Otherwise, I hope this tutorial has been helpful, and make sure that you read the chapter that goes along with this as well.